This is a prosthetic model that we will be using for the impression techniques. So we are trying to mimic the same position where we have placed an implant in the lower 6. So we'll be using it in this position. These are the impression trays we use. These are the impression trays that we use. It's called the foil technique. These are implant trays. Extremely good way to take an impression. So after removal of the healing collar, we place our impression post, which is also, you can see the conical connection. So there is no chance of it, there is cross matching because all the platforms are same. It has a long screw. Can be hand tightened or screw tightened. It's good to take a check X-ray, though with conical connections the chances of you going ORI are very less, but it's always good to take a check X-ray and then do your final impression. These are the impression trays that we are using for our open tray impression, which will be loaded with impression material. This is our impression tray with the material loaded. And as you can see, it very clearly punctures the foil and it comes out. You just have to be sure that the material on top of the screw is removed before it sets. You can use a probe or you can use any instrument for that. And then we wait for the material to set. So once we check that our impression material is set, we open the screw. Make sure that the screw is completely loose. Sometimes you may even remove the screw totally out if you want to be doubly sure that it's totally loose, and then you remove the impression from the patient's mouth, the model in this case. It is removed from the patient's mouth. This is your impression post, which is visible here. So this is an absolute recording of your implant position. Then we place an analog, which is also called an implant replica, which goes on to, this is an optional step. You could send it to the lab or you can do it yourself. And then you tighten the screw so it catches the analog. This component is sent to the lab in toto. This is your analog in place. We use a gingival mask called Gingifast, which is thrown around the analog to mimic your tissue. You should not overflow it, just all around gently so that it tries and captures your tissue margin for the technician to know how much tissue you have. And it should be exactly at level where the analog meets the post. You do not want to overpour this material. This is how your impression looks just before it is poured.